Well, welcome everybody to our online program on addiction and recovery from the Sunshine Coast Health Center up here in Powell River, British Columbia. And for the last few shows, we've been talking about the results of the research project that we recently completed here. And in particular, one of the key results that it seems as if people with addictions have a remarkably weak sense of who they are as human beings. They lack self-awareness. And they really don't know, for example, what they're feeling in the here and now, in the moment. And for research, this is very important stuff, but for practical purposes, it might be a good idea to spend some time helping people in recovery figure out, well, what they can do in order to gain this greater self-awareness. And I was talking to Dr. Aura Krug, who's a very fine clinical psychologist, about the results of our study. And she was thinking that it may be that what people suffering from addictions are missing is what she calls presence. This idea of presence she learned from her mentors, which were two of the most famous psychologists around, James Bugenthal and Irvin Yalom. And they were masters of this idea of presence. And it's a bit tricky to describe, but it's an experience, not an intellectual thing at all, just an experience of being aware of yourself. Really, like sitting down, understanding what mood you're in, listening to what your physical body is telling you, being aware of what emotions you're experiencing. So it's that sort of idea. I think most people understand the idea of presence if we bring up an example. For example, being present for others. For example, if you're a parent, you know your little one just loves to have you sit on the couch and watch Snow White 15 times in a row. Right? And they don't want to talk or anything, they just want to know that you're there. That makes them very happy to know that you are present for them. Okay, so it's that idea, only this time, to be present for yourself. So we'll spend some time on this in this series on our online program, giving you some ideas, all based on this idea of presence. And a few years ago at the Sunshine Coast Health Center, we tried a form of meditation that would encourage people to be present for themselves. It was a very good therapist who ran it. She understood therapy and psychology, and she understood meditation. She'd been doing it for decades. And on paper, if you look at the research literature, you discover very quickly that this sort of meditation is associated with good recovery. So we thought, well, this is a brilliant thing to add into the program. So the idea was all the fellows would take part in this meditation. What they had to do was get into a relaxing position, and then they had to empty their minds. So they just try not to think about anything, just to experience being themselves. And we did a little study on it. I think we thought that we concluded that our clients averaged about 2 minutes. That's about all they could handle of this form of meditation. In other words, it was so uncomfortable for them, they couldn't have it. They had to be doing something, they had to be thinking about something, and to be at least listening to something. But for them, just to be able to sit with themselves, to be with themselves, was just so uncomfortable. In fact, I think they almost went on strike in front of it. Now, we've changed that, so now we have an active meditation. So the therapist will provide guidance for them, things that they can think about, things they can imagine. And that works much better. But it's interesting the difference between these two things. On the one hand, just be with themselves, empty their minds, and just sit with themselves was so remarkably uncomfortable for the fellows. Although they can handle, if they're actively involved, actively engaged. So that's kind of interesting. And that's, I think, is a good example of People with addictions are so disconnected from themselves that when we encourage them to just be with themselves, it's just remarkably uncomfortable. Anyway, just as an example. And so we'll continue on with this topic next time on how you can develop presence, how can you can be with yourself with being a little more comfortable. Anyway, that's it for this time, and we'll be back next time with an actual example for you.